Health officials are trying to get a grip on an alarming outbreak of SARS.
The virus originated in mainland China.
Has spread across the country.
The disease had been festering for months in southern
Latest
China.
on the deadly SARS virus, the worldwide death toll up again today.
China has reported more than 1,400 cases of infection nationwide.
It is what health officials have feared all along.
Picture this. A young migrant in Guangzhou, China, is working as a butcher in an illegal Yewei or wild animal restaurant. On December 20th, 2002, he thoughtlessly chopped off the head of an unknown animal, just like the other thousands of times he's done so. Blood splashed on his face and entered his eyes. In days, he developed a high fever and enormous breathing troubles, unknowingly becoming patient zero of the 2002 to 2004 SARS epidemic.
What we learned in 2003 is that a new virus could jump species from a wild animal into human beings. That new virus could infect one human and could go from human to human. Once it goes human to human, that new virus could mutate. It could go airborne. It could do any number of different things that would make it really, really dangerous and potentially devastating for our society.
3 months after the first recorded case, Guangdong health authorities reported an outbreak of atypical pneumonia in hundreds of people. After 10 days, a doctor from Guangdong travels to Hong Kong, unknowingly infected with the virus. There, he infects people who then board international flights. He dies on March 4th. One of these people flies to Toronto and infects several family members. She dies on March 5th.
Right at the beginning of the outbreak, in the first 1 or 2 weeks of March, it wasn't clear how extensive this would be. Nobody knew what caused the outbreak.
My husband brought me to the A&E, and that moment I know that something is wrong in Singapore. The whole ED, emergency department, was full of, public for screening.
The public was anxious. There was very little information circulating around. People grew frightened of the number of deaths and new infections that seemed to only grow by the second. Anti-Asian racism intensified. Healthcare professionals struggled to find the right ways to treat the disease. There were shortages for masks, hospital equipment, and staff. Anyone who showed symptoms of fever, coughs, muscle pain, and an ominous rasping breath were immediately quarantined.
I was editing a magazine in Hong Kong. I was the editor of Time magazine in Hong Kong. This was a really big story for us because Hong Kong was one of the hardest hit cities by SARS in 2003. We covered that story very aggressively, and we believed it was an important story.
Carl Taro Greenfeld is a renowned journalist who has written many works on the SARS epidemic. During the outbreak, he was in Hong Kong, one of the places where the virus did the most damage. He recalls the fear and anxiety everyone felt during SARS.
In 2003, initially, there was a lot of confusion and a lack of good information about what was happening in China. So when the first cases began arriving in Hong Kong, which was where I lived, doctors in Hong Kong didn't know what they were dealing with. And perhaps if Chinese doctors had been able to share their information and what they were experiencing in hospitals and the type of patients that they were seeing and how contagious patients were and how dangerous this disease was, then hospitals in Hong Kong may have been better able to deal with these patients and this new disease. There was a lack of information about this disease, somewhat similar to what we're seeing this time.
This epidemic started with one person, yet it spread and went on to infect thousands of people in mainland China, Hong Kong, and other places. Initially killing more than 20% of its infected patients, the SARS epidemic would leave a strong cultural impact. It would expose ineffective medical and governmental doings, provide more knowledge on how to treat such infectious diseases, and drive countries to change and establish many policies regarding public health care. The SARS epidemic certainly provided an opportunity for countries to learn about treating disease outbreaks of this scale. During SARS, healthcare professionals learned valuable lessons on disease prevention, such as the importance of preparing beforehand and setting up effective quarantine measures, and China applied those lessons to actions that deal with the current COVID-19 pandemic.
I think China this time certainly improved in sharing data on the clinical side, what hospitals needed to do and what doctors needed to do. And I think China also cooperated much better with the WHO in terms of sharing what they were learning about the disease. China had the experience of SARS in 2003, and so I think China was able to move more aggressively in closing down travel in Wuhan and generally trying to curtail and slow down the spread of the disease as much as possible and act more aggressively.
In the end, what gives us hope is only the fact that SARS taught people important lessons about treating future epidemics with better equipment, more educated staff, and a newly built perspective on what should and should not be done.